that's good. And I wouldn't.
And it's Brittany again. I'm just coming to you with another update of how my tummy tuck is doing. Today is May 21st. I had my tummy tuck done on May 12th, so it's been about almost 10 days. It'll be 10 days tomorrow. Recovery, it's going pretty good. Day to day, it's different. Some days I'm feeling better than others. Yesterday I actually went to the grocery store. I actually sat down in the little cart and, my husband and kids did most of it. I just kind of supervised, so I wasn't doing any walking because my back does still get pretty sore because I'm still kind of walked over in a hunched over position. I am walking more upright and it's getting a little bit, less sore, a little bit more comfortable for me to walk upright. Other than that, been pretty normal. I don't have to take pain meds as much. I don't have to take the muscle relaxers as much. It's pretty much on a as needed basis, which before I was taking them like clockwork, like every 4 to 6 hours for my pain meds and every 8 hours for my muscle relaxers, just so I wouldn't have to deal with the pain or the soreness. But now it's just as needed, so that is a very much noticeable improvement as far as my pain and my soreness level. I did have my drains taken out when I went to the doctor on this past Thursday. That went okay. It hurt just a little bit. The incision where the drain was inserted closed up, like the next day it was closed. I didn't have any problems there. He also took out my sutures from my belly button. He said that looked good. So, and I'm just like, keeping it cleaned out, keeping it dry with a Q-tip, which is helping. Still wearing my garment. I actually don't have it on at this moment, so I might get a chance to go ahead and show how my belly looks overall so far. It's still a little swollen right now, which is to be expected. My garment is being washed right now, so I don't have it on, so I'm kind of laying back and taking it easy so that I can, keep down the swelling. What else? Still have my mom here. My husband's at work right now. My kids, my daughter has been helping. Everybody's been a great support system. Whatever I need, they're doing it. What else? I actually went to the vitamin shop yesterday, and I heard about this supplement or this herbal plant called arnica, and it actually helps with surgery and swelling and injuries dealing with surgery. So I got some of that, and I've been taking that since yesterday. I haven't really noticed difference yet because I haven't taken a full day's dosage of it. So I'm seeing how that goes. I'm a very vivid believer in supplements versus medications. I'm trying to, drink more water. I drink water anyway on a daily basis, but, being at home and not being active at work like I usually am, I'm not drinking as much water, so I'm trying to get back in the habit of doing that, drinking my water, to actually, keep down the swelling and push some of the fluids out. What else? And just basically not overdoing it. I'm just doing as much as I feel like I can do. I kind of get frustrated, irritated because things I see that needs to be done that I'm used to doing and I can't do. Even like just standing in the mirror, wash my face, brush my teeth, put my makeup on, has my back sore and has my abdomen sore. So I have to sit down and take a breath and rest because it feels like I've just worked out and I'm sweating and I'm hot and I'm sore. So stuff like that can get irritating, but overall I am pretty satisfied already with the results. I can't really get into some of my jeans right now. Even my jeans are kind of loose in the waist because my waist is still pretty swollen, but overall it's flat. Overall, the look of it is a great improvement. I still have my, I guess, surgical tape on the incision part of my tummy tuck, even though it took the sutures out of my belly button and the drain out. But he said the tape is to help with the scarring and make the scar look better or thin out the scar. So he's going to keep that on. I don't know if he's going to take that out with my next upcoming post-op appointment, which is coming up this Thursday on May 25th. So, but that's pretty much it. I was kind of nervous about doing a video diary. I've watched a lot of other video diaries about tummy tucks on YouTube just to get some insight and, you know, about recovery and get some insight on, you know, making sure this is a decision that I want to do. But this is something I've been wanting to do for years. I'm a mother of 3. I'll be 33 next month. I've had consultations with 2 plastic surgeons that said that all the exercise that I've been doing and the healthy lifestyle, my stomach was not going to be back normal like it was before I had kids. And my doctor did say that I had, you know, severe diastasis in my abdomen, which means my muscles were very, you know, separated that, you know, really need to be repaired. So I was already living a healthy lifestyle, already exercising, already, you know, drinking water, go to the gym, crunches, squat, I mean everything. And I could see like on the sides my obliques were looking good, but like in the center part it was still that extra bulge and sagging skin that I did not like. Like I couldn't even see my belly button, and like I hated it. Like to me it looked deformed. So I'm like, I don't want to go the rest of my life, you know, with my body or my stomach, you know, not looking normal. I just want it to be normal, and I can deal with the rest. Just give me my belly button back, and I can deal with the rest. So, but anyway, other than that, the recovery has not been that bad. The first couple, maybe 3 or 4 days were the toughest. After that, you know, as long as you're taking it easy, you're following your instructions, you know, as your doctor, you have your help, it really would be a breeze. I kind of have high tolerance for pain. I have 9 tattoos. I've already had 2 surgeries, 2 C-sections, so, you know, I do have high tolerance for pain, but for me, it was not really that bad at all, you know. I would encourage anyone who wants to do it, who's been wanting to do it, who are scared going under the knife, to do it. My doctor that I had here in Birmingham, Alabama, has his own private office. The cost was cheaper even than our big university hospital here that we have in Birmingham. It was cheaper than I expected. The results looking good so far. The doctors are great. I can text him with questions. I had a question about my belly button when he took the sutures out the next day. He asked me to send pictures so he can see what it looks like, and he said it looked fine. And I mean, my doctors were great. So anyway, I'm gonna pause and, you know, show a picture of my tummy and how it looks now so far. Okay, so this is how my tummy looks so far. Let's see. Like I said, I don't have my garment on. It's being washed right now. I just have this little gauze on, just, you know, for extra padding and protection. Let's see if I can get it more closer. But let's see. Gotta see if I can get a more closer view of how the tummy looks. Bring it down this way. So this is how it looks so far. Like I said, it's still a little swollen. That's why the belly button looks kind of closed in. Like I said, it's still tape over the scar. He said this will help minimize the scar. So I hadn't necessarily actually seen the actual scar yet. But it goes from, I guess from here all the way over to here. And this is where my drain was. He pulled that out. Like I said, that's healed pretty good. That's, I guess that's part of the scarring too, or part of the incision. So I like how low the incision is, right above the pelvic area. Tummy overall looks flat is what I wanted. When I'm approved to go back to the gym, then of course I'll have my six pack or look as toned as I want it to look. So I didn't have any liposuction done. It was just abdominoplasty, repairing the muscle walls, and removing the excess skin. So I'll give you all a side view as well, how it looks from the side. So overall it's flat. Said it's pretty swollen, like I can tell here, it feels kind of tight, even right here, even below the incision area, down towards pelvic, it feels a little tight. But like I said, I don't have my garment on right now because it's being washed, but I'll put it on as soon as it's done. Other than that, I'm pretty satisfied. So far, so good with my results. I just can't wait for the whole recovery part to be over. Get back in the gym, and start getting some real definition. And I'll show you up close of my belly button. I was just a little scared at first because it was still a little drainage or still a little kind of moist. But he told me just clean it out with a Q-tip and that helped. So, but anyway, that's my results so far on day number 11. Like I said, I'm standing up a little bit more straighter. Just still taking it easy. Not trying to do too much because like I said, I don't want to swell it and I don't want to have any excess fluid removed with the syringe because even though I'm in the medical field, I hate needles. So, yeah. Anyway, those are my results so far. And I'm happy with it. And I'm glad this is like one of the best decisions I've made for myself personally. Said it was an elective thing for me to do. But something I've been wanting done for years and I think I deserve it. After having 3 babies. And having, a pretty healthy lifestyle and, I think I deserve it and I feel, a little bit normal because like I said, I was feeling like it was kind of deformed in my eyes, and I will send or post a before and after pic of how it looked before the surgery, how my stomach looked before the surgery, and to me it's a dramatic difference, and I'm happy with it so far. So anyway, that's that, and like I said, I'll be back in a few days with some more updates and tell you guys how everything's going. Alright, anyway, take care. Have a great day. Bye.